The latest figures show that the virus is still spreading amongst us. It's natural to be scared and frightened by this invisible threat. It's also natural to want to do something to help your family, friends and community during this health emergency. Many people are volunteering. Teachers, pharmacists, cleaners, porters, key workers and those in our NHS have stepped up to the challenge. But there is something you can do to help. Please stay at home. This weekend it might be tempting to go out and act as if things were normal. They're not. Friends are getting sick, people we know are having to be hospitalised, and tragically one of our own has died. If you want to help yourself, your family, your friends and your community, please stay at home. I'd like to thank the staff at Manx Utilities for their flexibility and dedication during this period which is difficult for all of us. People may be worried about paying their bills and how to make ends meet as this emergency continues. We will not be cutting anyone off. If you're worried about your bill or finances, please call us. We're here to help. Our priority remains keeping our customers and employees safe. Our emergency contact number is 687 687 and staff are available 24 hours a day, every day. Our website has advice on energy efficiency and can help you manage staying at home. We will continue to provide extra help and assistance to vulnerable people in our community and urgently respond to any difficulties they may face. Our headquarters in Douglas is closed. We have turned our lights off to keep yours on. Our emergency continuity plan has meant staff working from home. Our skilled electrical teams are now segregated and backup control rooms have been established in geographically separate locations to minimise the risk of any infection. We are continuing to support water and electricity production, respond to faults and emergencies, maintain the effectiveness of our sewage network and support for 8,000 electricity prepayment meter customers. Prepayment customers are asked to ensure that their keys are topped up. We have increased their emergency credit to £30 to cover any period of self-isolation, and customers should check their meter display to confirm that this has been downloaded. I would like to take this opportunity to thank the vending stores and their staff who support the prepayment system around our island, and also those in the community who are helping those people in isolation by ensuring their keys remain topped up. Our drinking water quality remains excellent, and the reservoirs, treatment works and distribution networks are continuing to operate efficiently. But please use water wisely. Our sewage network is operating well, but please remember, bin it, don't flush it. This will minimise the need for our staff to try to fix unnecessary blockages. The natural gas supply to our island is working as normal, and we're working with Manx Gas to guarantee their services. Manx Utilities is owned by you. Our staff are members of your community. By working together, we can get through this. But to do this, please stay at home. Thank you. And now I'd like to invite any questions from the press. The first person I've got is from Isle of Man Newspapers, Duncan Folks.
Good afternoon, Dr. Allinson. You can't see me, but I can see you.
Okay.
I hope you and your family are well.
We are.
Good. Today marks the end. Today, Saturday, marks the end of another week in this crisis, which I think most of us will not forget in our lifetimes. And we've heard so many lovely, so many stories of people and businesses who've come together during this time. And I was wondering, does this, and I also believe I think it's no secret that you yourself have been helping out on the helpline. I wondered, does this heighten your belief in this community, in the island, as it does battle with this, dreadful scourge?
Yeah, yes, Duncan. I think you're quite right. We're living through history. In the future, the books will be written about this. We'll watch movies about this, but we're actually living through it. And I've been completely humbled by the way people have stepped up to the challenges we're facing. They're talking to each other. They're helping each other. And I think this is possibly unique to the island. This has brought out the best in the vast majority of people of this island. even coming into Timor today, people are staying off the streets, they are staying at home, but they're still helping each other, either by telephoning them or using technologies to communicate. So although we may be physically isolated, I think in some ways the community has come together far better, but often in a virtual way. So I'm absolutely humbled by the way the community has reacted to this. At a time of really quite a lot of fear, it's brought out some incredible bravery.
Okay, thank you. My second question, this is with you wearing your Education Minister hat, if I may. Can you give us an update on the situation regarding the education of youngsters of key workers and how that is going?
Yes. Again, as I said, lots of people have stepped up to the challenges, and amongst those have been the teachers, the SEN workers, also the cleaners and porters of our schools. What we've done is agree to open some of the hub schools, so some of the primary schools, and also the secondary schools to those children of key workers. The numbers are relatively small, but that allows those people to provide the frontline services that we really depend upon at the moment. We're also working with nurseries and childminders to keep them open, to allow them to provide those services, and we'll be making an announcement about the financial support to allow this to continue on Monday. But across the board, really, people have been concentrating on trying to support frontline services, but also realise that they are frontline services themselves. The pharmacists, the teachers, the people working in shops, they are keeping our society going. They are keeping our country together. And I have the utmost respect for them, because they often have to go to work, leaving their own families behind, and come back knowing the risks that they're taking. So I'd like to thank all of those people for standing up and stepping up to this challenge. In terms of education, we're also doing a lot of work in terms of those children who may be at home but have relied on free school meals. And again, we'll be making some announcements next week about that. And in this rapidly changing situation, what I've been so impressed about is the people's flexibility, their imagination, and their way of dealing with these challenges together and working together to try to overcome some of these.
Okay, thank you.
The next person on my list is Alex Bell from BBC.
Hello, Dr. Allinson. Just on the utilities point, you've mentioned some of that support which is available for people. I know that over in the UK, the Prime Minister is now facing pressure to actually suspend utility bills for self-employed and lower earners, pressure coming from Labour there. There's a petition, I also believe, which has surpassed 120,000 signatures calling for the same. Have Manx Utilities given any credence to this, or any consideration, I should say?
The Manx Utilities Board have discussed this, and we're working with Treasury. What we'd like to say at the moment is, for those people who may be anxious about their bills or anxious about paying their bills, talk to us. We will work with you on a case-by-case basis. But obviously, as the situation develops, we will be looking at other ways of trying to ease that burden onto those people who may be now unemployed or not able to go to work. So we are looking at it on a week-by-week basis. But the message is, if you're worried, talk to us early. We will deal with this. We will not cut you off.
Thank you. And on a somewhat related note, you did mention volunteers there in your opening speech. There are more than 250,000 people now in the UK who've signed up as official volunteers to help the NHS. As a member of the healthcare front, you must welcome that. There will be a healthy number of people who are sitting at home now, furloughed, maybe working minimal hours, sat inside for 23 hours a day thinking, well, I want to help out, but I don't know where to go. Is there any official option being considered for volunteering?
Yeah, that's a very good question. What we've been trying to do in terms of government is support the third sector, because volunteering has been an intrinsic part of the nature of Manx society for centuries. And so there are those live at home schemes, Crossroads Care. There are those organisations that really exist who need more volunteers, who need more resources, and need our support during this difficult period. Because obviously their fundraising activities can't happen anymore, but the demand for their services is there. I'm also aware that there have been various parts of government trying to coordinate some of the huge numbers of people who want to help practically. But again, this has to be done in an ordered way, because the stay-at-home message is so strong that if we are going to help people, it has to be organised, it has to be done by the right people in the right way. but also we have to restrict those movements around our island if we're going to fight this virus. So in answer to your question, yes, there is a lot going on. Some of it is very local, some of it is more national. So for instance, St John's Ambulance delivering prescriptions for people has been something that's been spearheaded right across the island. But I'm also aware that local communities, local people, even just a street, have been helping each other. And I'd like to see that develop as we go forward over the next couple of weeks.
Thank you.
Do you have any other questions, Alex?
No, that's fine.
Okay.
Thank you.
The next person on the list is from 3FM, Rob Pritchard.
Good afternoon, Dr. Allinson. Glad to hear you well. First of all, quite a simple question, expanding on some of the things you mentioned in your opening statement there. How well are the power supplies coping with the demand, given the amount of major changes everyone's having to make at the moment?
Yeah, that's a very good question, and was something that I asked. In fact, our electricity demand across the island has gone down by about 10%. Now, part of that is because a lot of businesses have closed, a lot of shops have closed, and although people are at home, they're using their electricity obviously a lot more moderated. We don't get that, unfortunately, we don't get that evening spike as people come home from work. So we're able to deal with the demand extremely well. Similarly, although people are staying at home, the overall water demand has gone down by about 5%. But the message is still there. Obviously, use our resources carefully. Don't waste water, don't waste electricity and power. But we will get through this, and we will manage to adapt to any increase in demand as people start hopefully getting back to work, and as those shops and offices start opening again.
Thank you very much. My second question, I know Manx Utilities has put information out there already, along with many organisations, but given the amount of information that all these different organisations are coming out, just for a bit of clarity, if people aren't quite sure, when you mention supporting customers, could you expand on some of the options that are being offered to help people financially?
Absolutely. For those prepayment customers who are using their keys, what we're trying to do is encourage them to top up, but provides that extra emergency credit, so that anxiety that they have to top it up straight away goes. For those people on normal billing, there will be various circulars going around with their bills as those go out, showing the support we can give in terms of paying their bills, in terms of trying to even that out so they don't take a big financial hit at a time when finances may be strained because of either unemployment or the extra costs of being at home. So we will be looking at a whole range of measures that we can try to help all customers, and that's domestic as well as commercial customers as well.
Good, thank you very much.
Okay, the next person on our list is Tim Glover from Manx Radio.
Yes, good afternoon, Minister. Glad you're well. I think all the Manx Utilities stuff, I think you've covered and have been covered in other questions, but, you know, it's great to see that they're maintaining services, vital services that they are. So I'm just going to mention Ramsey Grammar School and 3D printer and the fact that face masks for frontline workers are being provided there within your constituency. We go in the shops now and there are shields, but I'm getting quite a lot of comments about bus drivers don't have any shielding at the moment.
Okay. There's a huge debate at the moment about PPE, protective equipment. There's been announcements in the United States over the last 24 hours with their Centre for Disease Control, the CDC, recommending that people wear masks. Now, on the Isle of Man, we're still waiting for the World Health Organization to come up with an idea behind this. But I think we need to think about what that protection is for. Is it to protect you from getting the disease, or protect other people from getting the disease from you? Now, in terms of protecting other people, if you're unwell, you should be self-isolating anyway. There is still some evidence that those people may be asymptomatic and able to spread the disease, so don't cough over people. Don't sneeze over people. Use those common hygiene methods of washing your hands regularly. What we're trying to do on the island is the PPE stocks we've got, concentrate those on people who will get the maximum benefit from it, which are people who are working with those who've already got the virus. But we'll also be looking at other people on the front line, whether that's bus drivers, whether that's teachers, who do need some extra precautions. And we're taking advice from public health about that. I think one of the other things that's come out about this healthcare emergency is the fact that we need to be more self-reliant. It's shown that when the whole world is in a state of crisis, we need to be able to look after our own people, and we sometimes can't rely on those supply chains that we've normally relied on, particularly from the United Kingdom. So Fenodry Gin stepping up to the mark, making hand sanitizer, Ramsey Grammar School and a lot of the other schools as well, using 3D printers and their laser cutters to produce face masks that can go straight into Nobles and try to guarantee the safety of those frontline staff are really important aspects. And I think as we go over the next couple of weeks, we'll see more things happening. So, for instance, the work that's already being done at Nobles Hospital in terms of testing on the island, rather than having to send those tests across to the United Kingdom, is incredibly important as we go through this, so that we can devise the best policies that will protect our people.
Obviously, it's a time of great worry for a lot of the island's population. But I did get this in and thought, how on earth can I ask this in a press briefing? Under emergency laws, why don't we buy a big stash of cannabis, as some people really need to calm down? Then I realised, of course, it's Dr. Alex Allinson that was doing the press conference today, and I know you were talking much more about medicinal use of cannabis, but the messages are simple, aren't they, really? People don't need to get into a stew about things. Stay home, stay safe, have a date night tonight or something.
Yeah. They are, and thank you very much for bringing up medicinal cannabis. This is probably not the time and the place to talk about that, but we do need to carry on functioning as a country, carry on having debates about this, carry on. The sittings of Tynwald are all really important. The interesting things about this that perhaps the Chief Constable will be able to answer next week is with the lockdown, we're not actually having some of the drug smugglers coming into the island. So actually, there may be some silver linings to all of this. But in terms of how people react, for the vast majority of people, coronavirus will produce a relatively mild, self-limiting illness. What we're trying to do with all these measures is to protect those vulnerable members of our community and also our NHS from what could be quite a large number of people who would get ill and need hospitalisation. So we are taking these precautions not only for our own sake, but for the sake of our whole community. And so I think we do need to get this into perspective. We do need to adapt for hopefully a short period of time to actually stay indoors, to have a virtual pint with your friends over the phone. All these things can help keep us together at a time that physically we're trying to stay apart.
Thank you.
And the last on my list is Paul Moulton from MTTV.
Hello, Minister. Keeping the lights on and all the business having key workers, can you take us through this exactly? Have you had many occasions in a normal year where key workers from the United Kingdom or elsewhere have to come in to do jobs that can't be done here, be it sewage or electricity? And if so, have you had any since we've had the lockdown? And also, what exactly are the precautions that they get that can have access to the Isle of Man, where the people who can't get back to the Isle of Man are still being blocked from coming in? How do you protect those people and protect the Isle of Man in those circumstances?
Yeah, that's a very good question, Paul. We do rely on various specialists normally coming from the UK to do work here. For instance, when we've had some power outages, we've had specialised teams come over with special equipped vans that have got all the bits that they need to repair boilers and electrical equipment with. Obviously that's stopped, and as I said, we're going to have to be far more self-reliant in what we do. We have got some planned works on the power station that we've put off for the next 3 to 6 months so that we don't need to get people across. So actually, so far, we've been able to function quite well here. Our utilities have got some incredibly specialised staff who can use teleconferencing to get advice from across or even from further afield, because part of the machinery at the power station was actually built in America by GE. So we can work with those people to get the latest diagnostics remotely. If we do need to get people over, though, we will do so, and obviously go through the Chief Secretary's office to get a special permission to bring them over, and then we'll deal with them in a very strict quarantine way so that they're not at risk coming over here, but they don't pose a risk here either. One of the things we did right at the outset in terms of our contingency plans was also to have briefings for all our staff, because some of our staff may have to, in an emergency, go into the home of somebody who might be exhibiting symptoms. So dealing with these risks, trying to make sure people have the right information and knowledge so that they can do a proper risk assessment and keep themselves safe, as well as the people they're actually serving.
My second question is a repeat, really. I've always known you to be very honest and open when we've done interviews with you, and therefore I have to ask you this question because it didn't really get an answer yesterday. And we had tremendous feedback from people saying, please try and get answers. And obviously, we're restricted with just these two questions. And if I go back, it seems it's the second question, and then we all lose out.
If I could just say, Paul, it's a Saturday afternoon, so I'm quite happy to take extra questions from anyone who's got them. Obviously, some of the chief ministers' press conferences are slightly longer, slightly more detailed, but certainly I'd be more than happy to take any extra questions you've got today.
Well, this is with your Coleman hat on. Okay. We're all in this together. And I said the feedback I got after asking yesterday about what is happening to people in civil service who are being at home but can't work or whatever. There was not an exact reply. I mean, some are working in 111, but I think people want to hear that we are all in this together. I mean, any way that people will have to pull in their belts a bit as well in civil service?
Yeah, I mean, if I could just say to you that the last 2 weeks have probably been the busiest I've had since I was a junior doctor. And I've been in the Timwell building, and some of the civil servants here have been doing 100-hour weeks. That's not paid. They're doing it because a job needs to be done. They're in here first thing in the morning at 7 or 8 o'clock. They're leaving here last thing at night. There are people backwards and forwards updating websites, doing work, trying to have meetings well into the evening, whether it's at home through video conferencing or actually physically in the building, although obviously we're trying to minimise that. So at the moment I'm here relatively alone in the building, but there are people working for government, working for the people of this country at home right as we speak, where normally they should have been having a weekend off. This is really all hands on deck. People have also been stepping up in terms of volunteering. I know a lot of public servants have been doing work in their own communities, whether that's organised in terms of the 111 line and also some of the other helplines that have been set up, or it's just helping out in their communities. These are members of the community, and they're helping their neighbours. So genuinely, right across government, people haven't been just staying at home watching Netflix. They've been actively involved in keeping the government running, keeping these essential public services running, but also keeping the country running.
And then there's no overtime being paid then to civil servants then in that situation? Or can they claim, if they're working 100 hours, can they claim that money?
As far as I know, people probably could claim. Whether they will is very much up to them. But what I've seen is people not worrying about the money side of it. They want to get the job done. They want to actually reassure people and get us through this. And genuinely, right across government, I've been amazed by the way people have stepped up, whether that's teachers coming in on weekends and bank holidays to make sure that the schools are cleaned properly, whether that's healthcare workers taking on extra shifts just because they know that they have to. And also, just yesterday I was talking to a retired GP who'd finished 30 hours on the 111 line. I mean, he was almost hoarse from all the talking he'd been doing, but he wanted to play a part in this. He wanted to use his expertise. So right across government, but also right across this country, people are stepping up to the mark.
Thank you.
Do you have any other questions, Paul?
Well, I don't want to monopolise, but only one more quickly then.
Yep.
Is the website being updated twice a day? Is that some sort of way of making it look less, the numbers? I mean, that's what, instead of just a once a day proper update. Do you think it is suitable to do it twice a day? I mean, and are those numbers going the way you thought they were?
Very good question. I think people want as much information as they can. As they can get, and the way for instance, the tests are done is a bit cumbersome because the swabs are taken, they're then taken to Nobles to be processed, they're then flown away, and then we get the results back. So they often the way the results come back is staggered, and I think trying to put those out twice a day and getting the latest up-to-date information is really important. The tests are one thing. What I'm, as a clinician, really interested in is the number of people in hospital. That's what a lot of the work's been done, is to protect our NHS, to stop it being overwhelmed with people. And we've all seen the pictures from Italy. That's what clinicians don't want for our island. So seeing the numbers that are coming into hospital, is really important. We know that the vast majority of people, if they get the virus, it's relatively mild and self-limiting, but we need to look at those numbers of people who go in hospital, and unfortunately the numbers who don't come out, those number of people who end up dying. So that sort of information I think is really important, just so we can, so the public, people like yourself, can see that government are working on this, because obviously testing has been one of the big questions around this pandemic. When to test, who to test, what test to use. And we are changing all the time. We're learning from the experience of other countries in terms of whether we do the DNA testing for the disease or whether we do the antibody testing to see if people have got immunity. And different countries have had different policies on this. We know that Jersey are going to try to test for the antibodies. What we're trying to do on the island is test for the disease, lock it down, quarantine it, stop it spreading. And I think people should be reassured by the number of tests we're doing, unfortunately, the number of positives we're getting, but actually acting on those and trying to limit the damage that this virus is going to give us.
Thank you.
Tim Glover, I think you wanted another question.
Yes, thank you very much, Dr. Alex Allinson. You've mentioned that electricity, we've got a lower demand. Are we selling any to the UK?
Yeah, very good question. Normally we do try to export because it increases our revenue, increases the profits, allows prices to be kept low. At the moment, obviously, the UK have got a bit of a lockdown as well. So we're actually importing about 10% of the electricity we need because the prices have gone down, and we're actually able to use some of the green energy that's being produced by wind farms in the UK to supplement what we produce on the island. So the energy trading and the energy transfer is quite dynamic. We look at where we can buy and where we can sell on a day-by-day and sometimes an hour-by-hour basis. So when we can export, we will when it's needed. But on the other hand, if we can import and keep the prices down, we'll do that as well.
Thank you.
Any other questions?
Yes, please.
Yep,
I've got
certainly.
one, if that's okay,
Absolutely.
Dr. Allinson. So given with all the different circumstances that are going on, there are still going to be everyday things that may affect some of the supplies to the island. I'm thinking we could have burst water mains, which we see that will need sealing up. We could have power cuts to homes or even entire streets. Given the restrictions in place, what abilities do your teams at Manx Utilities have to deal with those, and how long do you expect them to take?
Yeah, a very, very good question, because obviously business carries on as usual. Despite the virus, people are still going to get sick, they're going to have appendicitis, but also mains will burst and power lines will come down, particularly if we get some storms. What we've tried to do at Manx Utilities is make sure we've got the resources here, the supplies, the stockpiles that we need. But if we do need extra equipment, we can obviously get it in either from the UK or from Ireland, because we have very good links with the utilities companies on both sides of the Irish Sea. In terms of the staff, their training is obviously right up to date, and their safety is paramount. So I think we're in actually a very good position on the island to look after the utilities here. In the past, when we've had really bad storms, obviously our workers have actually gone over to the UK or over to Ireland to help them out, get their power lines up and running. We won't be doing that at the moment with the travel restrictions, but what we'll be focusing on is trying to sort out faults here as soon as possible, and I'm confident that with our staff and their ability that they'll be able to do that. Does that sort of answer your question?
Yes, it does. Thank you. I've got just one more very quick one, and then I'll
Certainly.
hand over to someone else. I'm aware we are on certain timeframes here. We obviously saw 2 years ago during the TT, obviously we had stunning weather for that, but we also had to have a hosepipe ban in place because of the drought that was happening. If that situation was to occur and the water levels got too low on island, what contingencies have you got for that during this pandemic?
Yeah, again, very good question. Before all this kicked off, one of our main issues was the water supply to the island, given what had happened in previous summers. We've already taken steps to maintain the raw water supply. So, for instance, our reservoir levels at the moment are around about 92%. We've turned off the hydroelectric plant at Solby, because although that produces green energy, which is great, it uses a lot of water, so we're conserving stocks. We're trying as much as possible, if we get water main leaks, to cap them off as soon as possible to stop that water being wasted. But as we get into what could be another hot summer, we'd ask people to think ahead, to use water wisely, and we will be putting out publicity in the near future around that, like we did last year, because again, even more than ever, we have to be self-sufficient. We can't rely upon help and assistance coming from our neighbours. So we need to do those early measures to try to preserve the raw water stocks on the island. I hope we don't have to do another hosepipe ban. I hope it doesn't come to that. But certainly we would bring that in early if we thought there was any risk to the water supplies for our island, particularly at a time that we're also trying to tackle a viral pandemic and make sure that people wash their hands and stay at home.
Thank you very much. Thank you.
And Tim, I think you had another question?
Yeah, so to use Tynwald to speak as supplementary to the answer you gave earlier about greener and cheaper electricity coming in, will that be reflected in people's bills as supplementary to that?
We've got a 5-year pricing strategy that was agreed by Tynwald. What we're doing at the moment is going through an extremely challenging time when prices, whether it's for raw utilities like gas, oil, but also the currency variations are all over the place. So we will look at trying to keep prices as low as possible. But that's going to be really quite challenging at a time when also we're having increased costs by trying to respond to people. Some of the really good plans we had, for instance, electric vehicle charging and also the rollout of smart meters have obviously have to be postponed for a while because we can't visit everyone's home and start replacing their meters. So there is a lot of work there that hopefully when we get through this viral pandemic, then we can roll out and hopefully show people the benefits of some of the plans that we had at the beginning of the year, that like all of our plans, whether they're business or they're personal, have had to be put on hold during this period. Okay. Well, if there's no further questions, I'd just like to say thank you very much for taking part in this. I think these press conferences are really important to try to get messages across, but also in terms of the accountability and asking questions. I think that's really important. So I'd like to wish you all a good weekend. Please stay at home, but please also stay safe. Thank you very much.